So now I will go ahead and turn it over to Todd. Todd, you are unmuted and ready to go.
Okay, thank you, Marcy. I've got as well, I have Tina Smith with me as well for the long-term care portion of this, and any specific questions that she can address. So I just wanted to introduce her as well. So I'll just go ahead and get started. These are what we're trying to do is kind of answer questions that you may all have. And before I start that, sorry. Before I start that, I want to go through some of the Certification Bureau team commitments to reiterate those commitments that we have, and we expect you to hold us to them. So public protection being number one, that's where we focus, and many of our folks that are here, if not all of them, are here because they either worked in the healthcare industry or have that desire to protect the public, much like you all do. So in a regulatory arena, that's where we're at as well. Communication, and part of the communication we're trying to improve on is through our newsletter, through these presentations. So if there's things that you want us to cover, please let us know. We'll address whatever the question is. Consistency, so being consistent with not only amongst ourselves here in the office, but with providers out in the communities as well. CMS, as you all know, went to a long-term care survey process that's standardized. And so CMS has that same issue across all states of being consistent with how, each state is applying these survey requirements. So again, we're in that same boat and trying to be as fair as we can and consistent as we can as we do our work. Then accurate reporting, providing a report that is defendable, and certainly there's many steps to that, and we go through a quality assurance review on in-house as well to try to make sure we've got everything as correct as it could be. However, there are other processes, the informal dispute resolution process that for long-term care you can use to challenge anything we have written, and I'd encourage you to do that. That's another check and balance for us, and we certainly learn from that, and we also we do adjust the reports based on some of those results of those IDR findings. So, and then our final one is continuing education. As you all know, it's a challenge to continuously keep all this information in our heads and in front of us, and then it changes. So we're continuously trying to educate ourselves and work on understanding the changes CMS is sending to us and how that impacts you and us and everyone. So again, these are our commitments as a team. And so going on to our agenda, what we're going to talk about today, the phase 3 requirements that CMS had introduced and actually made them enforceable, I guess, in November of last year, 2019. Then Chapter 5 of the state operation manuals and their pending revisions to that. Focus areas set by CMS by Denver and Baltimore. Questions, specific questions that you had and you sent to us, and Marcy's provided to us. F600 and past non-compliance. Wanted to talk a little bit about that. F600 is the abuse, neglect, and misappropriation tag for long-term care, and CMS's direction on past non-compliance for that. And then if we have time, any additional questions. So that's our agenda. We'll start out with phase 3 regulations for long-term care. The facts that as of today, we have heard nothing further from CMS about when those are in effect, other than they say November, I believe, and I can't remember the date, 28th, I believe, of 2019. But with that being said, there's nothing in the database for us to even cite as far as tags or locations to put, if there was an ethics issue with a facility run their training program or whatnot, it's not even out there to cite at this point. So that's, where it's at. We don't know when that, and what we're referring to is the long-term care survey process that we're using right now. It's not up to date. the Aspen system that holds all the data and that, pre-populates the deficiency as far as what it's related to or what the, the core issue is. That is not up to date. So we have no additional direction on surveys expectations for this right now from CMS as of today. And then if we have an issue, we are to speak with CMS regional office. And to be quite blunt about it, I don't see us having an issue. We just can't cite anything. It would have to be very egregious. It's one of those issues that are in phase 3 to come up. We are just really on hold with these regulations for phase 3. So I don't know if anybody has a question or specific to that. The status right now.
Again, all lines are muted, so if you do have a question, just unmute yourself and feel free to ask, or again, pop your question into chat. Thanks, Todd.
All right, thank you. Okay, I'll move on to Chapter 5 of the State Operation Manual and the changes. And what this is it's related to these facility reported incidents, and CMS was looking at the timelines to have us out in the field sooner to review a complaint that's, or not a complaint, excuse me, a facility reported incident that is significant. For example, maybe there was a rape in a facility that we became aware of through the facility reporting incident. We may end up coming to the field sooner. And so they had proposed changes, and we have not seen finalized changes to that. And again, it focused a lot on the timeline. So, for example, immediate jeopardy. If we had a complaint or a facility that reported an incident that appeared to be in immediate jeopardy, we'd have so many days to get out. Currently, it's 2 days. So if it's, say it's a non-immediate jeopardy that we need to get out, and it's considered non-IJ high, they had a 10-day requirement right now, 10 business days. Again, they were going to tighten those deadlines and define them a little bit more. So it would kind of really come back to us as far as being on site more frequently. If there is an issue, that's categorized or triaged a certain way. So that's really what that's, it's pending right now. And as you may have noticed, they're not even issuing S&Cs or what they're calling QSO memos now, the Quality and Safety and Oversight memos, because again, their system has slowed down. Review is required before anything's issued. So in the past, they used to issue those things, it seemed like at least once a month, a couple of them. We haven't seen some for quite a while. Yeah, the most recent we can think of is the coronavirus. Yeah. So obviously that's pretty imperative at this point, but that's kind of what we've been seeing from CMS as far as their direction and providing us direct input timely. It's taken time. So they are proposed. So again, the bottom line would be this would increase our time in time to us to respond on site to go and review these kind of issues. And again, it's based on a triage program that they set up. The other part of this they were going to also do is provide what is mandatory reporting as far as facility reported incidents. And I shouldn't say it like that, mandatory, but give us examples of things they wouldn't want to hear about. They were actually going to provide some of that as well. So I think it would be good, and that side of it is to provide all of us some guidance on, what kind of issues have to be reported. And I would give you the example of the one that we've heard of in the past of, say, a person just, throwing a ball or something in the facility and hit somebody. Is that abuse? Is it not? Should it be reported? Was it an activity? How did it occur? Anything like that. So maybe give us some guidelines and some definitives for reporting. So that's what we're hoping. We'll see how that turns out, and we'll share that as soon as we know. So again, that's the Chapter 5, reporting things for complaints and facility reported incidents. Then going on to the next one, these are the 4 CMS focus areas for federal fiscal year 2020. So basically started October 1 of 2019, runs till September 30th of 2020. The primary areas, abuse and neglect, and then those are the F600 through F602 to 610 deficiencies or tag numbers. That was last year, you may remember that as well, being their focus area. Nutrition and hydration, F692. Unnecessary medications, F757 and 758. And then pressure ulcers, F686. Those are the 4 areas that between the regional office and the Baltimore office of CMS, they have divided or decided these are the areas they're going to look at when they come on site and review us. Typically through the Federal Oversight Survey. And we've had one so far this year, one facility, we had one at Crest, those FOSS surveys. So we anticipate 2 in the year. So we would assume we'll see another one before April 1st, somewhere in Montana. These same topics do apply to the non-long-term care, and I'll kind of go over that a little bit. These areas as well, CMS has really kind of, put a lot of enforcement and actions into these over the last 2 or 3 years. Many of these topics, especially the abuse and neglect section. Again, the other thing I was going to say is that CMS that we work with, the regional office in Denver, has now been combined with the Kansas City regional office. So we're going to be part of them at this point. So we're not sure how that's going to look as far as from CMS and how we interact with them. They're changing some of their management as well and how it's set up and how they're administering things. So we're not quite sure what to expect at this point. They just announced that probably in January of this year. So we didn't, or we just, we're totally informed at that point. But there's a lot of empty or questions we have and things we're unsure about how it's going to turn out. So trying to think, we also have life safety code areas that are surveys that'll come out, and I know we've had 3 of those reviews so far throughout the state. And that's usually done by an outside contractor that goes in after us and reviews the life safety code portion of the survey specifically. It's more like a comparative, as some of you may recall in the past, where within 60 days or so many days after we exit, they have to come in and kind of do a check and balance review of us and see if we found everything we should have found. So the health part of it, I'll go back to this as far as the oversight. They do initially come on site with us as a resource, is what they're calling it. They don't necessarily write deficiencies. They will work with the team. They enter with the team. They also, communicate with that team and work through the process. They don't directly speak with the provider or the nursing home administrator or whoever. Typically, they let it, and still run the survey process through our team coordinator in the state. However, after April 1, then they will start what they call the comparative stage, where again, we would go in and survey, and we would anticipate 2 more, so 3 more this year, 1 before April 1st, and then 2 more after April 1st that'll be comparative. In other words, they go in within so many days after we exit and they do their own separate survey and kind of compare how we did versus what they found. So that's a little bit about our focus areas that we know of from CMS, and some areas that obviously they're going to look at us for these, so we're going to look at these areas for you as well. Again, here's the focus areas, and I wanted to just remind you that some of these will also be carried into the non-long-term care sections of things, so such as a critical access hospital. For example, C0381, for those with suite bed programs and critical access hospitals, those are things we would look at. It's very similar. In fact, it references the Appendix P, which is specific to long-term care for some of this information. So if you want to take a look at this particular tag in their system with your swing bed program, this will help you kind of understand what we're going to look at. The second one is nutrition, C0410. That is another area that CMS has stated that they will review in long-term or non-long-term care, such as a critical access hospital. The other two areas for unnecessary meds and pressure ulcers, they don't have anything specific that we're reviewing under. But however, anything could be looked at as neglect or abuse if it's something that, like a pressure ulcer where a person isn't being taken care of properly, it could be cited, in even under that freedom from neglect section of it. So it doesn't exclude you from it, but it doesn't have specific areas where they're going to look at, such as unnecessary medications, or we will not evaluate that part of it. But again, if we got a complaint that's specific to the CAW and the suite bed program, we could look at that to see if it is part of the neglect of the facility or of the staff with a particular resident or patient. So those are the focus areas that we have or we're aware of. So then moving on to the first.
Todd, this is Marcy. Before you move on, I do have one question in chat. How long do the federal surveyors have to complete their comparative surveys if you are one of the selected facilities?
They have typically, I think their newer days is 30 days after we exit for the health. In the past, it was 60, and that's what I think they're applying to the life safety code, but it's 30 days.
Great, thanks.
You bet. Okay, I'll go on to this first question then. The specific question was about compliance and ethics requirement. And again, this main question was, have the surveyors been trained on this topic? Is there information to share with providers on this topic? And the answer to that is no. As I said, the phase 3, this is part of that, or a portion of it, the ethics, and I think both of these are. We have not received anything specific. Tina, have you seen anything else? No. So we're not ready, we're in the dark as well at this point with this and what the expectations are. We're waiting for some kind of final direction from CMS and also to provide that training to us as well. So yeah, this is a good question, and that's where we are at with that one. The second one was about the area of enhanced precautions. The use of enhanced precautions for swing bed patients would seem appropriate if written in policy and procedure. Would survey have an issue with this? And then I give you a citation in there that that even in the swing bed program, if you have it in place, we certainly can review it. It is not specifically required that you use this, this enhanced precautions requirements. But if it's in place and it's a policy, we can look at it and then hold you to that, making sure you're following your own policies and procedures. So, but remember, we are enforcing minimum requirements. You can certainly go above and beyond and improve your system, to maintain your infection control programs. So, it's certainly something we would look at, and we may even critique because of the survey process and, the result for the patients or residents. I'll also give you some frequently asked questions about this that CDC puts out, and it's one of the sources that CMS has said is okay to use their material. Within the reg set itself, under C203 to, 278, it does list other providers that they're, or consultants, if you will, or other areas that you can get information on. And it's certainly acceptable, you know, to use these others. And let me list them a little bit for you here. Sorry, I'm looking through the reg set here to find it. 278. Oh, there it is. Okay. They list in here. Oh, I got the wrong place. Yeah, they don't. It's not right here. I'll find it where they do recommend or give you a list of other, you know, acceptable sources for these kind of infection control issues. Maybe it's under one of the infection control tags. So I'll have to look at that and get back with you on it. So going on, the last item I think that I really had for you today that we thought would be of interest is the past non-compliance with F600. And I'm going to let Tina speak to this somewhat because she's far better at this than I am on that particular issue, because she reviews all the reports that the surveyors put together for long-term care. But the source of this information that I put on the screen is in Appendix P, Guidance to the Surveyors for Long-Term Care Facilities. And I've given you a link as well here. But the fundamental portion there, the part that really sticks out to me, is it talks about and this is CMS's terminology in this interpretive guidance. It has been reported that some facilities have identified that they are in compliance with F600, free from abuse and neglect, because they could not foresee that abuse could occur, and they have done everything to prevent abuse, such as conducting screening of potential employees, assessing residents for behavioral symptoms, monitoring, etc. So it keeps going on and it explains all this information to you. Then they say, however, this interpretation will not be consistent with the regulation, which states that the resident has the right to be free from verbal, sexual, physical, and mental abuse. Therefore, it is the survey team has investigated and collected evidence that abuse has occurred. It is appropriate for the survey team to cite the current or past non-compliance at F600, free from abuse and neglect. So we have done that at least 2 or 3 times this federal fiscal year. We have had and we'll go through the scenario. Basically, a provider had reported, had done everything they should have as far as reporting it to us, you know, an alleged abuse or neglect. And in this particular case, we did find some issues with what they had done after the fact. And correct me if I'm wrong on this, Tina, as I go through it. So we did cite it as past non-compliance, and there is no response required for the provider, but CMS will look at it, and they do at times issue still a financial CMP, a penalty. This is the direction we're getting from CMS, and it is in this regulation set. So we want to be upfront and forward with you about it and let you know what we know about it. The other portion of this, it kind of gives you some more detail in that same section of Appendix P. It talks about that the facility was not in compliance with the specific regulatory requirements at the time the situation occurred. So some failure existed. And it's all 3 of these in my mind. The non-compliance occurred after the exit date of the last standard recertification survey, and before the survey, and they talk about standard complaint or revisit, currently being conducted. And finally, there is a sufficient evidence that the facility corrected the non-compliance, and it is substantial compliance at the time of the current survey for the specific regulatory requirements as referenced by that F tag or K tag, which would be the life safety. So this is the direction we're getting from CMS. It's in the requirements. Tina, do you have anything to add further to that?
Yeah, when the surveyors go out into a facility, just to let everybody know that there's been some growing pains with the changes of this new process. And so there's been a little bit of changes each time a facility gets cited as we're learning more information. So I'm in the process of putting together a training for all of the surveyors, and I would like to probably present that to the providers in the future on it. But when you're looking at past noncompliance, the surveyor has to identify two really specific things. The first one is that the facility had the deficient practice. So the expectation is that the surveyors go into the building and gather their evidence, which would be their observation, record review, and interview, and show that the deficient practice actually occurred. The outcome would then be something such as possibly the facility reported incident that occurred. And then the other component is they have to show the facility's corrections. So the expectation is the corrections are carried out fully and sustained. And when the surveyors are looking at those, they're looking at basically what a facility would do for a plan of correction. And there are criteria that a facility must meet for a plan of correction, and the facility doesn't have to do a plan of correction for a citation that's past noncompliance because they've already done it. And the facility has investigated, or excuse me, the surveyor investigated and gathered the evidence of that. So it's what the facility needs to really do is once they identify that deficient practice, show how they're working through those steps of correction as far as identifying the corrections for the person, for the systems, other people that could potentially be affected, what system changes need to occur, if at all, and you're going to document all of these things that you're doing, and then you're going to show how you're evaluating and monitoring all of your corrections and your progress, and you're going to show your QAPI involvement and how QAPI has provided oversight. And once you determine that your corrections have been made, just like you do on a plan of correction, then you're going to monitor that through your QAPI process moving forward, and you're going to show how you're sustaining your compliance. CMS expects that compliance is maintained from survey to survey, and it's pretty clear in Chapter 7 in their initial expectations that they do not want compliance to be cyclical, that they want it to actually be an ongoing and very consistent process. The surveyors are in looking at substantial compliance, and so when you look at the scope and the severity grid, you can see that levels A, B, and C are noted as being substantial compliance. So if you have anything that's a level A, B, and C, that would be in that area of substantial compliance. And Todd was talking about an example where facilities may possibly have enforcement action, and that may occur when a facility is found to have a deficient practice for past noncompliance where they were cited at a higher level. So possibly a G or even a J, and then the past noncompliance came into play and the facility identified before the surveyors got there, carried out their entire plan of their correction. They evaluated, monitored, they're monitoring through their QAPI program, and they have successfully sustained it for a period of time to show that their corrections are in place. If the facility was cited at that higher level, then we have already had the regional office go in and actually cite enforcement on those instances. And it hasn't happened very often because we don't find that very often, but it has happened. So as I said, I'm in the process of developing the training right now for the surveyors. And then again, I would like to roll that out for all of the facilities. And since it sounds like all 71 facilities are now on board and have signed the agreement with the foundation, that would be a really good start probably for us to go in and maybe assist with some of the changes that are going on within our state. And if there's any questions on that, feel free to let me know.
Tina, we do have a question in chat that says, if cited past non-compliance, does it count against your 5-star rating? And then the second
Yes,
part is, okay, go ahead. Why don't you answer that part of it?
I'm sorry. Yeah, yes, we believe it does. It does count against the 5-star. In fact, from my understanding, they have put in some kind of a red hand, or not a red hand, but a hand that shows that indicates there has been a past non-compliance. It's my understanding. So I haven't validated or confirmed that. What I'll do is do that and make sure what does come up and provide additional detail on it.
Okay, if you could just get that to me, Todd, I can forward that on
Sure.
to the group. And then how do we know scope and severity on 2567 when cited for past non-compliance?
It's going to show on the deficiency just like any other deficiency. The difference is going to be is on the 2567, you're going to have way over on the far left, you're going to have the citation and the severity and the scope. And then you're going to have in the first column to the left, you're going to have the deficiency and the corrections that the surveyors identified. And then on the right, at the very beginning of it, it's going to show the language that's automatically inserted through our program that it was an issue with past non-compliance. And it shows on there that no plan of correction is necessary.
And Madeline has a comment in chat that she looked and there's a definitive visual. Are you referring to the 5-star rating nursing home compare, Madeline? And she said yes. So.
Any other questions?
Tina and Todd, this is Marcy. I have a question back to the abuse and neglect. Is there any training available for facilities on abuse and neglect, nursing homes that you know of?
Not other than anything that's currently presented on the CMS website for all the providers.
So I'm sorry, there is some information, it's just the information posted on the CMS website. There's nothing you guys do aside from that.
No, and as some of you may recall, we had at one point we attempted to put together a guidance on reporting of incidents and things like that, and it just opened up a whole bunch of different questions. We were hoping again for this Chapter 5 changes that it'll provide some of that guidance to all of us. It'll say this is not reportable, this is. I'll be honest with you, if somebody calls us or me and asks me whether we should report it or not, I'm going to tell you to report it. It's a requirement, and it's better to do that than to take your chances of not reporting it, and then it's found on survey or something that it adds additional tags as far as being not reported, not meeting the 24 hours, or maybe even 2-hour reporting requirements. So.
Thank you.
Mm-hmm.
I'm going to go ahead and just unmute all the lines. If anybody has a question, go ahead and feel free to ask Todd or Tina. Or go ahead and put your message in chat. Does anybody have any questions? And I'm sorry, you guys at the conclusion of your presentation, or did you have more slides after this?
I think, no, that was it for us.
All right. Okay, well, I am not seeing any additional questions. One last chance. Okay, well, Todd and Tina, thank you so much. And again, this is the recording, when it becomes available, we'll shoot it out to everyone. And Todd just recently sent out, right before the meeting, the updated PowerPoint. So you should have that attached to your appointment. And then the next call we have scheduled for May 14th. That's a Thursday, same time, from 2 to 3. And again, feel free to reach out to Todd and Timor, with any questions that may come up in the interim.
Okay.
You guys have
Thank
anything
you.
else to add? All right. Well, we'll give you some time back in your day, and thank you everyone for attending.